You know, when you're looking for someone to handle your primary care, you want to be sure that you find some great representatives that care for you, that don't think of you that you're just like a number. Well, here at A Better Health in Biloxi, that's just the way they feel about it. Molly Brown, who is a family nurse practitioner, and I'm happy to say is my own nurse practitioner. Been with her for 6 years. How are you?
I'm good.
Well,
I'm good.
Well, good. Then don't aggravate you too much, do I?
No, not too much. Not too bad.
Tell us a little bit about yourself, Molly.
Okay, well, I have been a board-certified nurse practitioner for going on 12 years now. I have been nursing patients back to health for 28 years, though. So I started my career pretty early on, and then after that went back in and furthered my career. And so out of 28 years, I've probably spent 12 plus of those in mid to upper level administration management, and moved here to the coast in 2017 and ended up going into primary care practice full time. And so I've done that since then, but also I've spent about 7 years as Chief Operating Officer for UMMC Hospital up in Grenada and Holmes County.
Oh, nice. What made you decide to go into a private practice for yourself?
Well, I really didn't. So I worked for a health system, and they decided to close the location to consolidate, and just it seems like one thing led to another. I had so many opportunities kind of present themselves. So I say that this was God's doing, because it's like one foot in front of the other. There were so many opportunities that just came in and presented themselves, and I was just kind of following what was going on, and it was kind of amazing how that happened, you know. And I had people calling me and people offering to help. So I was able to get this practice, and once I decided to just go into my own, it's just like everything came together. I even had patients and colleagues and everybody coming in and putting furniture together and everything. I'm telling you, it was amazing. But it was such a spider web of events to say that I was really not in control of any of it. But here I am, and I'm happy to be here. And I just want to give a shout out and thank you to all of my community, my patients, my family, my friends, and even shout out my prior colleagues at Merit Health for their support in this.
What are your beliefs about healthcare?
So, what I don't believe is counting a number, and what
As
I don't believe
that, yeah.
right, is counting a number, and what I don't believe is treating a label. And so what I mean is when you have a diagnosis or a label slapped on you because you've met like a certain number of symptoms to give you a diagnosis. You know, there's a lot of guidelines out there, but it's not intended to be a cookie cutter approach, right?
Right.
And so what I feel like is that just like you don't judge a book by its cover, you know, even the good book says no two people are alike, that we take standardized medicine and we use evidence-based guidelines, but then we also look at the individual. You know, we want to treat you according to your health needs, not just what the standard of care says. Standard of care is based on what the average American health is. Well, we know that the average American is not
the healthiest in the world.
Right, it's not the healthiest in the world. So we look at that, but we also
even those that get out there and work out all the time,
I know.
they're not, they have issues.
Yeah, but there's other things that are involved that we try to look at, like, genetics, traumas, exposures, different other things that not everyone necessarily looks at. And I have the ability to test for those additional things as well, to just help give you the best care possible, and try to drill down and find root causes to things. So we use a lot of kind of functional integrative medicine approach in addition to standardized medicine.
So what makes your practice different from other primary cares?
So I would say the individualized health care that we were talking about there. And, we're trying to offer more services here too, and we'll get to that in a minute whenever we talk about what services we are and plan on having.
That's what I was about to ask you. What services do you offer? And while you're talking about that, we're going to take a little tour of the facility here.
That sounds good.
So tell us about that.
Yeah, so we manage chronic health conditions like your average diabetes, hypertension, high cholesterol, to name a few. Also do annual physical exams, including school, work physicals, your annual Medicare wellness exams. I do DOT physicals. We also do sick visits. We also do offer, women and men's health. We focus on weight loss management and obesity. We do a lot of counseling and education, health coaching, and I do have a service that will be available to patients after your visit for continued health coaching. We also will be offering IV therapy, and you'll meet one of the ladies that we're having in a few minutes.
Okay.
And so IV therapy is another option that we have. And so we're just looking at all these things: genetic testing, cardiac risk assessment. I mean, there's so many things we can provide. I've got them all listed on my card, so we'll be glad to post that at the end too, to share just all the services that we're going to be having.
Well, let's meet
here.
some of your wonderful staff here. We're at A Better Health on Tommy Monroe Drive in Biloxi.
Adrienne Boyce is our business office coordinator, and she's the one that really runs the show and keeps us in line. She's excellent at what she does and has been a great asset to build the business side of the practice. Angie Coffin is a nurse practitioner that will be joining us in the next few months, and she offers primary care to patients, but also offers a holistic integrative approach to health care. She also provides IV therapy to help patients interested in combating inflammation, hormone imbalance, dehydration, chronic fatigue, post-COVID syndrome, and other deficiencies. Deborah Four is a primary care nurse practitioner as well that is aimed at getting you to your ultimate health. She is passionate about providing education to patients and giving them the tools they need to get to a better health. Her focus is primary care and will also be available for walk-ins and annual wellness exams, to name a few.
What do you see for your future in healthcare?
Well, I see the future of healthcare as a collaboration between the patient and the provider. You know, I believe that the help belongs to the patient, so the patient should definitely lead that, and that we are here to help guide them and help them along that journey. So we want to be sure that they're making the best decisions possible and that they are in the forefront of their own health care, and that they're taking the responsibility to be in charge of their health, and that we can give them the tools they need for that.
And a lot of people don't realize that it's in your hands, whether you want to get well, if you want to stay well, if you want to live a healthy lifestyle. You're just there to give them guidance, and you're very good at it. Very good. Like I said, she's been working with me for like 6 years now, and I feel pretty good. I've had a couple slips here and there, and I have to say thank you again for checking on me. I recently had hernia surgery, and and you called and checked on me, make sure I was okay, and I appreciate that. Yeah. So again, if you looking for a new place for going to get checkups and things like that, A Better Health. They're located on Tommy Monroe Drive in Biloxi. Phone number's on your screen, website's on your screen. You can get more information on that. But if you need to make an appointment, pick up the phone, give them a call, and I'll be happy to set up something for you here with A Better Health on Tommy Monroe Drive in Biloxi.